All right, you guys, this is part 2 with my interview with Shannon. She is my nurse injector from SkinLuxe here in Nashville. She's seriously the best. If you missed our first episode, we deep dive into filler. We talk about Morpheus, Sculptra. I mean, we do a lot in that first one, so I definitely recommend checking it out. But hi.
Hello. We're back.
So today I really want to talk more about Botox, and I mean there's so much we could, this is going to be like a whole episode about Botox basically because
it's probably one of the things, the biggest complaints in aesthetics that we get. And I think a lot of it is this misconception, and a lot of people that, you know, that we see, we try to like educate them, and a lot of times I just haven't had the education to understand like why they're, I would say the biggest complaint is, oh, so neurotoxin is just like a blanket term for, there's different brands of Botox per se. So there is Botox, obviously, that's Allergan, Dysport, Galderma. There's a new one called Daxxify that's from Revance. There's Juvederm. So there's all these, Xeomin, yes. And so there's all these different, but the concept behind them is all very similar. If you can't fold the paper, you can't make the crease. So you stop the muscle movement. It prevents, you know, wrinkles from forming or getting worse, or, you know, all that. So a couple misconceptions I get is, or complaints is, my neurotoxin didn't last. Okay. Well, there's multiple factors for that. Some people just have a high metabolism, or they just metabolize it quickly, which stinks. But a lot, I would say 90% of it is not understanding that the correlation between dosing and longevity. So dose equals duration. So I think the FDA approved dosing for the upper face is like 60 something units. So 20 in the crow's, 20 in the glabellar, which is your 11s, and 20 in the forehead. That is the FDA approved dosing for those areas for a reason, because you want the longevity out of it. Now, if I were to put 20 units of neurotoxin in my forehead, I would not look very good because of my anatomy, because I have a very short forehead, my brows would look very flat. So I do a lighter dose in my forehead, but I understand that the 6 to 8 week mark, that's probably going to wear off, and I'm going to have to be treated more frequently in that area. But I prefer that because I like the look of it better. So people have to keep that in mind. The average length of a neurotoxin is 3 months. And my coworker, Tori Crook, has said it best. It is like a roller coaster. So you inject it, it peaks at 2 weeks. So at 2 weeks is when we would do any sort of touch-ups or anything. And I'll get into that in a second. And then it peaks and it starts to take a slow dive like this. So you're not frozen for the whole 3 months. And that's the misconception people have. It starts to wear off. And if you are doing lighter dosing, you're definitely not going to get longevity out of it. But it depends on why you're doing it, what we're doing it for. But understand those concepts so you are like getting treated appropriately, or that you just understand that it's not going to last as long.
Yeah, because like when I do mine, I use Dysport, and I like to have movement. So I know it's not going to last as long as possible. Although, I mean, this time it lasted
really long.
So
it still
long.
Looks really good.
No, it doesn't.
I mean, that's moving a little bit, but like it's still not bad.
I have like set lines now, which we're gonna talk about this because I do have questions, because I have to stop using it for a little bit while I figure out what's going on with my functional medicine doctor, and I'm not happy about it. So we're gonna talk about Botox alternatives as well, but sorry.
No. And so I think that's like the biggest thing that I like to explain to people. And if you think about it, if I were to put, say, 10 units in your forehead, but the recommended dose is 20, well, if you have to come back in 8 weeks and we redose your forehead, you're still spending the same amount of money. It's not going to cost you more to do that, but just know that that's why that's happening.
But you might like that look more. So it might be a little bit more high maintenance, but having the movement makes you feel like better.
You look, and that you feel like, you know, some people are like, if I do too much on my forehead, I feel like I look tired. Like I don't like to be completely frozen. So that's some of the things that you're giving up by dosing, you know, a little bit lighter. Nothing wrong with it. Just understand that. The 2 week mark is imperative. Like I cannot tell you how many text messages that we get 4 to 5, 6 days after treatment, and they're like, I'm still moving, or my right brow still. It's not, if I were to go ahead and treat you at the time frame that you're noticing this, when it all kicks in, now your brows on that right side that I put a little bit over is going to be totally different than the other side. And touch-ups are common. I mean, those things happen, especially new patients. You can always add more, but you can't take it away. So if I overdo it, trying to get you not to have to come back in for a touch-up, then now you're stuck that way for 3 months. Versus let's come up with a plan together, what you've had in the past versus and the results that you've had versus what I kind of think that we should do. And then at the 2-week mark, if you're still having movement or want to add more, we can add more. But I think that's so important because people just really don't understand why we're making them wait 2 weeks and they get frustrated. Or sometimes like some people just have a stronger side. Like, I had a client message me a couple weeks ago. Everything was frozen at 5 and 6 days, except for her, like when she lifted her one eyebrow, she had this little comma. Well, I did put extra tox over that brow when I did it. And I'm like, I don't want to touch it for 2 weeks because I'm going to overshoot it. And then you're going to have no arch to that brow and your other side's going to look weird. So I think those are the things that people totally don't understand and have complaints about. Another thing is neurotoxin does not treat the lines that you currently have. So I get a lot of people that message and they're like, hey, it's been 2 weeks and my lines are still there. And the first thing I ask is like, can you make the face that you made prior to injections? No, I'm frozen. Well, those lines are just there. It's going to take time and microneedling, medical grade skincare for those to improve. And they will improve significantly from what I've seen. So we just got to stay consistent with getting neurotoxin every 3 months. And then if you have lines that are there, we're going to have to treat those in other ways. Because all I'm doing is stopping the movement. I'm not treating what's there. And that's what people don't understand. I feel like, which is easy. I mean, if you're not in this business, like you just know that Botox and Dysport or wherever makes things smooth and you don't realize like, oh, I didn't know the lines wouldn't go away kind of thing.
Right. Well, yeah. And then you also see your friends' results and their results are completely different than yours, or they only needed 15 units and you needed 35. And so you can't just say like, I'm going in for Botox and this is exactly what it's going to cost and these are going to be my results. Like you don't know, especially your first time. And I think that it's important to let the nurse or the injector figure out what your face needs. Give them a few times before you decide if you love them or not, because it's not a one-size-fits-all approach.
And I think too, like it's hard, we'll have patients come in and they totally want to dictate their own care. Well, underdosing you is doing you a disservice. You're going to pay for something that is not going to give you the results. But I understand it from their perspective too. I've had patients that have been to other places and they way over-treated them. And, there's an ethical component to this industry that I feel like some people just, like, I hate to be blunt, but they lack. It's turn and burn. It's get them in, get them out, make that money. And it's sad because it changes, I think, people's perception. Like I had one patient, I was like, what in the world? Like you're 20 something years old. They treated your entire face, like DAOs, chin, lip flip, 20 units. I mean, her bill was $1,100 as a graduate student.
For Botox.
Exactly. She had no idea. They did not quote her prior. And she doesn't need that. She's in her 20s. What are we doing?
Right.
Like, she hated the way she looked. She hated the way she looked at graduation for school, because she her mouth couldn't move. That is wrong in my opinion and unethical. And I won't do that. If you need it, and I feel like we're getting to that point, then yes, I'll have that conversation with you. But I understand from a consumer standpoint how when they come in and they're dictating dosage to you, why that would be, especially if they've had an experience like hers.
Yeah, for sure.
Like, is this really what's recommended, or are you doing it to make more money?
Right. Well, right. And then you could put more units in an area just to make more money when it's not going to make any difference if you put more or less. So, yeah. And the thing with Botox is once it's in, it's in. You can't dissolve it. So it has to wear off.
So she was for 3, now the lower face tends to wear off a little bit faster, but for weeks, for 2 months or so, she hated the way she looked in pictures and she couldn't move anything hardly, I mean, her animation was totally bizarre. And it's funny, like in having injected her for a while now, she doesn't really need that much. Like every 3 months she comes in, and not every time I have to fully dose them. And that's another thing too, guys. Like some people, like, they'll do 20 units in their glabellar region, and then they come back in 3 months and like they're having some movement, but not to, in my opinion, where we need to put another 20 units and do 15. Treat them with what they're showing up as. Don't just throw a bunch of units in their face. Like, I don't know. I'm real passionate about that.
That's a good point. Like, just because you did it last time, you might not need it next time.
Yeah, so just dose appropriately for what they have. And if people just tend to get a lot of longevity in certain areas, you don't necessarily just have to throw 20 units in there. Yeah. So, you know, that kind of stuff is just something that I'm really... I don't know. I'm just...
Well, it's a hot topic.
It's a hot topic.
Too, because she got her first bad review. And I want to, if you're okay with it, I want to tell the story because I think it's important for you guys to hear the way that Botox worked. The patient came in 7 months ago, and it was for another one of your nurses, and she told her what to put in her face. She wouldn't listen to the nurse's suggestion, and then 7 months later wrote a bad review about it, and it's like,
and so much of that was a misconception of what was needed, and you know, we also were able to brought her back in for a touch-up that we didn't charge for, and then we're like, you know, we told her like, hey, give it 2 weeks if you're still dissatisfied, or, you know, let's chat again about it and we'll make it right. We didn't have any knowledge that this person was not happy with their service, and so we reached out to her today and kind of got more information and made it right, and she was very kind to take her review down. But that could have totally been avoided had that patient had the right education and information. And so I hate reviews like that, because the back end of it is people don't understand her side of the story, and they don't understand our side of the story as business owners, and just the miscommunication and misinformation that she had to make that review, and getting frustrated with her results. And another thing people think, and I cannot tell you how many times I hear this, well, my Botox usually lasts 6 months. I don't know where what Houdini
6 months is
Houdini
like
neurotoxin that you're getting, but that's typically not it. And so, but we hear that a lot, and one of the things that the injector brought up to me today about that review is like, maybe she had this misconception, or maybe and hadn't brought it up to me, that this was something that should have lasted 6 months. So hence the review almost, 6-7 months later, like, why do I have all of this? And then not understanding the process and the solution that we were willing to, we didn't know anything about it because she reached out, we corrected that issue. And since we didn't hear anything, we thought that she was satisfied. So, definitely worked on a solution with that, but it made me want to talk about this today because it was just out of miseducation and misinformation. And
and it's just kind of unfair to come back 7 months later and complain about it. Like, I mean, also with Botox, you don't want to write your bad review the first week because, like we said, you need more time to figure out how it's going to settle. And the place you go should have you come back in and figure out if you have anything you want to change. But it's always easier to add more. So if they say you need less than what you usually get, listen to them. And then when you go back in a few weeks, you can add the rest if you need it.
And the feeling I probably had, and like I said, I don't know this person, but I think in her maybe dictating some of her care was probably the fact that, like, she may have had an experience just like my one client did, where she went somewhere and dropped $1,000 on Botox to support whatever. And so now she's like, when I go somewhere, I'm telling them what to put in because I'm not gonna get ripped off. And but then in turn, you're not getting the results that you're wanting and the longevity in your treatment, which is what her complaint was, because you're adamant about. So there's just kind of this meeting in the middle kind of thing. And we, in owning a company, I try to stress to patients, like, there's not been a time that we have not made something right for somebody, whether that's refunding them. I mean, that's not something that we typically just want to just offer refunds every 2 seconds, but if it's legitimate or they're really dissatisfied, like, let them, like, I want you to be happy, and it's not a cheap thing that you're doing. So if you're not wanting to let us make it right in our office and you would prefer just to go somewhere else or whatever, like, I'll just give you the money back. Like, you know, you can actually use Morpheus for hyperhidrosis.
What's the hyperhidrosis?
Which is excessive sweating. Works great. But we've had somebody that it legitimately just didn't work for her. Well, she spent $1,600. I'm going to refund you.
Yeah.
I think that's fair.
I think that's really nice of you, because I know a lot of other places that would never even consider that.
I just felt, I felt really bad, and she's super, super sweet, and it just, for whatever reason, it just didn't work. Mm-hmm. And I think that's fair. And even,
That's something else I love about you and just your business as a whole. Like, your prices are so fair, especially in the Nashville market. The prices here are absolutely insane. And you guys, like, you've kept it very fair for the whole time. I've been going to you for over 3 years now, and I send all my friends to you. Like, everybody I know goes to you, and they never feel ripped off. All of their results, like,
I think it's important. I think when people get into aesthetics, some of the reason is, I can make so much money. Yeah, you can, but like, you do the right thing by people and it just comes back tenfold. And I think with that review, one of the things that we had talked to, the client about was, hey, feel free to reach out to us anytime. Like, you don't have to leave a review to get our attention for us to make it right. And I think some people have that thing like, well, in order for me to feel like I'm going to get a refund or for them to make it right, like, this is what I have to do. Right. At least at my company, no. Like, if you don't feel like you're getting the response you want from the injector that you're going to, because a lot of times, if it's a patient question, we'll refer it to them first. Mm-hmm. Then ask to talk to a manager, ask to talk to one of the owners. Like, we'll be happy to, listen to your side of the thing and make it right. However, whichever path that is, whether that's you coming in and we comp, your next service to take care of that issue or whatever, or whether you're like, no, I just really want to go somewhere else, or I don't think this is going to work for me. And, but those situations are pretty rare, but when they do come up, we do try to make that right for them. So yeah, it all worked out. I mean, I think it's one of those things that I've been waiting for. I feel like if any business owners are listening, you're going to get a bad review for whatever reason. And I guess advice to that is if the patient's willing, hopefully they'll allow you to reach out to them and kind of get more of their side of the story, and you guys can work on a solution. And a lot of times they'll be really kind, and once they feel heard and that they've arrived at a solution that is, reasonable to them, they'll take their review down.
Mm-hmm. Yeah. And for everyone else that's listening or watching today, don't just leave a bad review. Talk to them first. Like, these are people too. They're business owners. They're trying to do the right thing. I think most business owners are really out there to have a good, successful business where everybody's happy. But we segued away from Botox. So
I know. I think sometimes too, like, I've definitely had experiences with different companies where, like, they're not willing to work with you. And then that's where I feel like the reviews are good, because you're kind of warning other consumers, like, hey, had this issue, like, it was a big deal, and they're unwilling to come to a solution, and I'm out X amount of money, and whatever it is, my air conditioning's still not working, this is not happening. So I think it's good in that regard, but I feel like just reach out to the company first. And if you don't get what you need, and I do think it's good to warn other people if you're, dissatisfied and no one's willing to help. But yeah, I think going that route first, and then
yeah, especially with these, like, customer facing businesses where, like, you guys are on Yelp. It's really
it's everywhere.
It's like your Google reviews. So it's easy to just completely ruin a business with a bad review, when in reality, like, you just had a weird experience. Yeah. It's not the norm.
Yeah.
But so anyways.
So it will happen to all business owners, and I think my only suggestion would be to reach out to them, see if you can make it right, and see if you guys can both come to a solution and take the review down.
So, like, I had Voluma one time. The first time I had it done, I got one syringe in both cheeks, and it was nothing. Like, I couldn't see it at all. And I contacted the business owner, and he worked with me. He was so nice about it, and he actually gave me another syringe. Like, I was not expecting.
Oh yeah, we've done that too. Like,
but it's like, this is your face, and so it's just, everybody's gonna, like, one syringe could look totally different in me and
Yeah.
someone else, and just because they thought one syringe would go further than it did doesn't necessarily mean that it's like bad on them. Like, it's maybe they got in and your cheeks were fatter or whatever.
Yeah, or your skin was thicker. And yeah, so I feel like a lot of the reviews, at least I see in aesthetics, are mostly like people that just didn't have enough of the like information. So one of the things I've talked to my staff about is like, give them the good, the bad, the ugly, and under promise and over deliver.
Mm-hmm.
So that they're set up for like, you may need 3 syringes, or you may not have the result that your friend had.
Yeah.
So they already are prepared in their mind for that. So that, you know, if they're like, oh, she did mention I need another syringe.
Mm-hmm.
So a lot of it's education. But yeah, I mean, your result was totally different, but instead of leaving, you know, a review, you're like, let me go to the owner first and see if there's something that they can make right. Because people are spending a lot of money on this, so they're going to be upset if they don't get what they want. Like 2 syringes of Voluma is like $1,800.
Right. Well,
that's a lot.
Totally.
So for you to feel like you had no result.
Mm-hmm. Yes. And
it's upsetting, you know?
And like with your Botox not lasting as long, like there's so many outside factors that could also like contribute to why it didn't last. Like it just came out that the COVID vaccine might make it not last
as long,
or like zinc supplements help it last longer. Like there's all these weird things that you could be doing in your life that
excessive workout people. Like I have some patients that are training for like fitness competitions. Well, their Dysport and Botox ain't lasting because they're just like metabolizing it. So there's just things, and I think if you work with your provider and you guys talk about all these different things that can be contributing to, you know, the results that you're getting, that they will be able to kind of come up with a solution for you, you know?
Yeah. So, okay, let's talk about Botox versus Dysport. I think those are the 2 most common ones, and I switched to Dysport probably 2 years ago now because the Botox just wasn't lasting as long, and you noticed it wasn't lasting in most of your patients. So
I don't know. I don't know the real reasons why these things happened, but they did in my experience. And so they're made by 2 different companies. They're both considered neurotoxins. There's always a little bit of difference in the products, but not the active ingredient, that's not different. So for whatever reason, Dysport just started lasting longer in my patients. And, you know, some people say the dosings change, you know, post-COVID vaccine. But I kind of just go off of whatever results I'm getting so that my clients are satisfied. Mm-hmm. And so I personally have just gotten a little bit better results from Dysport. But some people love Botox and other providers get great results with that. I think it's just very dependent on you know, your practice and your patients. And And I've got some clients that love Botox. They're never going to stray from it. And that's okay. I love it too. It's just, you know.
And you offer both. But so like then there's Xeomin, which
is made by Mertz.
And you don't have that one, right?
I have a Mertz account because Mertz makes Radiesse.
Oh.
But the thing is, it's like if you start offering, in my opinion, and more business advice to people, if you offer like 900 neurotoxins, you're gonna start throwing some things out because like it's only good for so many days after it's mixed, like usually 30 days. So you may have someone who loves Xeomin, but then you may not have another client that requests Xeomin or Dysport or Botox, whichever neurotoxin you're using. So the 2 that I get the most requests for, that I use the most, are Botox and Dysport, just in my practice. And so those are the 2 that I carry because we go through them quite a bit. And then there's Daxxify, which is a new.
So you made such a good point with Daxxify, where if there was something that went wrong with injecting and that you got a droopy brow or whatever, now you have Daxxify that lasts longer.
So it's supposed to last longer, and I have not had any, so to preference I have not had any personal experience with Daxxify. I have not injected it. I have not had it injected. The concept behind it is that it's got a proprietary peptide that is supposed to allow for longevity of this neurotoxin, but it is dose dependent as well. And so I believe, and don't quote me, I should have all the studies out, but I believe in the studies that they were injecting the glabellar region, which is your 11s, with 40 units. Well, and that some people had results at 5 months. Not everybody. And so, and you know, for me, it's weird. People are weird with neurotoxin. You could tell them you got a filler that I like dug up in the backyard and it's new and it's great. And people like put it into my lips. Neurotoxin, they are weird about. Like if you tell them it's new, like trying to get patients, like when we like all that COVID stuff, and I'm like, let's try Dysport on you since, you know, let's see if it'll last longer, or vice versa. You've been using Dysport, let's go to Botox. People know those names, and so they're not like freaking out about it, but they're weird about stuff. So it's just something that, you know, I don't have the experience with it to talk bad about it, but the concept behind it is kind of dosage equals duration. Well, if I put 40 units of Dysport in your 11s, how does that compare to Daxxify?
Right.
I don't know.
That's a lot of units.
It's a lot of units
right there. Like
average is 20.
Right.
So are you getting?
Isn't it more expensive?
It's more expensive. So you're trying to, in my opinion, for my practice, I think it's hard to sell something that not only is expensive but doesn't 100% guarantee that you're going to get the 6-month results. Not saying anything bad about it, because I never want to talk bad about a company or product. This is just what I've heard about it, and what, you know, as a business owner trying to figure out, like, is this something that I should bring on? I would be curious in some of my like patients that you are dosing really well, they've tried Botox, they've tried Dysport, and they're having issues with longevity, if that would be a better product for them. And I think that's where I would try to utilize that. But yeah, it is more expensive, and it does require more units to be effective dose-wise and longevity-wise. So
you're not really saving money, it's just maybe lasting longer.
Is the conclusion I've come to.
Yeah. Okay.
So like I said, I'd be curious, like if somebody like said, hey, I'm gonna inject you with Daxxify, and like I'm like, do it. Like I'm down. Let's see where we go. But yeah, I think that's been my hesitation with bringing it on in my practice is, would people be willing to pay that much? If I do a lesser dose, would they get the same longevity? Would it last longer than what they're currently getting? You know, and I don't know the answers to that yet. So what we've decided to do is kind of let that product be out for a while, kind of talk to some other people that have been using it and see what their experience is, and then decide if it's something that we want to bring on.
Yeah, I think that's a good way to look at that.
Yeah, I'm like, we'll just let that
let it ride.
For a minute. But yeah, people are weird with the tox, man. They're weird.
What's your favorite area to do?
Like with like toxin? Oh, I will say this, like the Nephrodite neck lift is super fun.
What's that?
So that's where we
should go through all the areas.
Oh yeah. So the muscles are DAOs, mentalis, platysmal bands.
Wait, okay, so point and say where you're pointing.
So your chin, like where your marionettes would be, or like
the lines going down from your lips to your chin.
Yeah. And then the bands that a lot of people see when they stick out, like if they're smiling, they'll see these like bands stick out.
In your neck, you get these bands that are like...
And some people's are really prominent. So depending on how much that they have and how much pull down is how much like kind of like lift they'll get. So if you treat the bands in the neck, treat the chin, treat the marionette area, and you can also go along the jawline as well. All of those muscles are a depressor. They're going to pull the neck down. So if you relax them, you get this really sharp neckline.
Ooh.
Because you've now knocked out the muscles that are pulling down on the neck. So it's really cool. And if you find the right candidate for it, then it's
Am I a candidate?
You don't have like your bands only pop out like when you're straining.
Yeah.
So you may get some from it, but not like somebody who their bands are always prominent and they pull down a lot. But that's a pretty cool trick.
That's really cool. I haven't heard that one, because you hear about everyone putting filler in their jawline to try to make it more defined. Mm-hmm. So this is like another way that you could potentially define that area.
You can just make it look a little more like snatched, as people say. I think if you're still lacking and you just don't have much of like a gonial angle then I still think you'll need some filler or something there. But I definitely think that, you know, it does make a big difference if you're a good candidate. It does take a lot of tox. The bands typically depends on 10, 15, 20 units. So depending on how many prominent bands that you have. So you could definitely rack up a a significant tox.
There's your $1,100.
There's
Botox.
your $1,100 Botox. But some people love to do it like before their weddings or before an event. And it feels weird. I'm not gonna lie. I've had it done. I loved it. It just feels funny at first until it all like you get used to it.
Yeah,
but you don't look weird. You just feel funny.
It's like a lip flip. So they put Botox above your lip, like right on the border of your upper lip, and it flips it. So it does two things. Like it can flip it up and make your lip look bigger. So if you're thinking you might want to try lip filler, you could try lip flip first. And also if you have a gummy smile, it like prevents all of your gums from showing as much.
Yeah, it'll flip. So basically what it does is that like when people smile, some people's muscles in their lip, even if they've got full lips, pulls their lip under. So it relaxes the muscle so that you can't do that. So you have more lip show. Another theory that people have talked about is why does my lip look fuller? Well, we all have lymphatics. Lymphatics drain. If you cannot move your mouth as much, then some of the lymphatics can't drain, so your lip will look a little bit fuller. But it's not volume, it's just an illusion. It's something that kind of some people just want to play with. You can treat a gummy smile. It's the muscle kind of above the lip called the LSAN, and 2 to 4 units can change your life. Couple that with some filler, easy fix. So some people don't even know that, and they're like, oh my gosh, this is like makes such a big difference.
I'm jealous of people with gummy smiles because you can do a lot more filler than I can do. Like my smile or my upper lip covers my top teeth when I'm like not talking or smiling, and so I can't do as much.
Yeah, so you would not be a good lip flip person because when you smile, your lip is going to be your teeth are going to be completely covered. Same thing with me.
Yeah.
Yeah. But people I
did have one. And it actually did make a difference. It made my lip look bigger, which was exciting for me.
Yeah. I know people do, and it does make it. I have a couple of clients that they love it. Like, I have more than a couple. I have a lot of people that love it. And it's just so easy. It's 4 units, bing, bang, in and out.
I like how you do it too, like the way you charge for it, because some med spas
I just charge per unit, whatever unit is.
Like they charge per unit. Some med spas charge per area, and a lip flip will be like $100 to $150.
But it's like 4 to 6 units. So
yeah, it's literally so inexpensive, and no one just comes in for a lip flip, do they?
No, the only people I do have that come in for that are just like if they get their Dysport or Botox and they get like 3 months out of it, or they're on the 3-month plan. Lip flips typically wear off 4 to 6 weeks, so they may come in for a lip flip between their next treatment, but most of the time we just do everything all together.
Yeah, it's not just like I'm coming in for my 4 units of Botox.
Yes. So most of the time, we have a couple like younger clients, like early 20s, that are considering filler, but they just want to try. Their friends have had a lip flip and they want to try it. And so, I mean, other than that, like you said, most of the time they're getting other services. So it's just, but yeah, we do just charge by the unit. I mean, I don't know.
It's so much more fair. Your prices really are the best. Okay, moving up the face. We did chin, like moving up to lip flip. You can do bunny lines in the nose, which I have. When I smile, I like scrunch my nose up. So you can put Botox here.
Yep.
And it calms those down. Can you do anything like around the piriform, like nasolabial fold area?
Not really. I mean, that LSAN, the gummy smile drop, is about around like the piriform, like here and here. You can do a lip flip at the bottom too, which I don't typically. You can. I don't typically. I feel like God, you won't be able to move anything. Like you really.
Yeah, lip flips are hard to use straws and spoons.
So if you had both, like I think it would be weird.
Yeah, you'd be dribbling on yourself. Oh, we forgot about the masseters.
Yes.
Masseters are cool. Like when I really clench my jaw, nothing happens, so I can't do my masseters.
Yeah.
So but like have these like Bethany Frankel from Real Housewives of New York, like her masseters used to be
huge,
massive, and she looks amazing. But it's a ton of units, right?
Usually it's like 20 to 25 each side the first time, but you don't want to overtreat the area because there's just weird things to consider. But yeah, and I don't really like to treat people who aren't hypertrophied, meaning that the muscle is not bigger than it should be, because you're just going to look really hollowed out in the back, because now I've taken like that muscle and I've shrunk it down. Some people notice their masseters when they have a lot of volume loss, I'm like, your masseter looks big because you have no meat above it, so you're noticing it. But if I inject that, you're gonna look even thinner in the face.
Yeah. So what would you do? What would you inject in their cheeks to make it?
So I probably, if they don't have a lot, if they're seeing their muscle because of lack of volume, then I would probably do Sculptra back there first. Especially if they're not complaining of clenching or anything like that. Sometimes they just notice the muscle, but they're not having symptoms that they're aware of.
Yeah. So Sculptra would thicken the collagen.
Yeah, it's just gonna fill them in, so you don't notice it as much if they're not having issues. Sometimes people they have a ton of like TMJ complaints or just very large muscles. I think it's great for those people.
And then, so you do under eyes, you do crow's feet.
Yeah, you can do crow's feet. So that whole muscle is like your orbicularis oculi, like that goes around the eye. So you can, I'm just weird with how I dose crow's feet because you can really look unnatural and you can really look bizarre, like shelving. So I'll full dose until I get to like the medial aspect of the eye and then microdose all the way around because it'll help smooth it out without making you look weird.
Because there's like the roll I've been seeing.
The jelly roll.
The jelly roll under your eye. So you can inject that and it smooths that out.
Yeah, like
do
one
I
unit.
have a jelly roll?
I do too.
Oh. Would it help me with my concealer stopping creasing?
Yeah, you could put like, it's one unit like right under the lash line.
Oh God, that's like, so she's pointing to her lashes.
Like it's like right underneath. You
her lower lash.
You put a unit there, yeah.
Can you do Botox on your eyelid?
Yeah, it's kind of this new thing. I'm like, I have not done it, but I've seen it done. Some people want to look a little more open, so you can inject the opposing muscle, like 1 to 2 units on each side, to make your eyes look more open. Now people take that, like, don't come in and like want everybody, otherwise you're all gonna look surprised, like just kind of scared. But even some people that have, like, I don't know, like a semi-ptosis or just like I have one client, she's so funny. She's like, my one eye is just not as open as my other eye. I'm like, I would never even have noticed that. But yeah, she wants me to do that. And I think it's appropriate for that, type of patient, but I don't think I would inject everyone's eyeballs.
So, okay, so we did the eyes, crow's feet. Nothing really in the temple area, but you can do, now we're talking forehead, which is probably what most people start with.
Yeah.
And so we have the 11s, which are like when you scowl your eyebrows, you have these lines between them that look usually like an 11 because it's each eyebrow like forming a line. And so you do that. And then for me, one of my eyebrows is up higher than the other. So we always have to like add more to calm it. But okay, this is what I wanted to ask you because I have my Botox or my Dysport has completely worn off and I feel like my forehead feels so heavy. And so I, like when I'm not talking or doing anything, I feel like I have to lift. Otherwise my eyes get tired.
That's weird. The only thing I could think of for that.
Were we lifting them?
Probably if we, I think we've done crow's feet. Crow's feet is a depressor and so is your glabellar, like your 11 region. So a lot of times when you relax both of those, you get a medial lift from the glabellar and then you get a lateral lift from doing the crow's feet. And then we dose your forehead pretty light. So like you're probably still getting that lifting mechanism. And so it's probably would be my theory on probably why you feel heavy now that it's all worn off.
Yeah, I don't like it. I miss Dysport.
I'm like, it's all worn off.
It has worn off. I've been getting Botox pretty consistently since I was like, I started when I was 23, but like I would say 28 is when I started doing it regularly. And now that it's completely worn off, I do have set wrinkles in my forehead, but they're very light. They're not deep. And when I get Botox, they go away completely. So it can definitely make lines go away. But like Steve has set lines, my husband, and those, even when he gets Botox, they're just there. And so
they look better, don't you?
Way better, so much better. So for people who still have lines, what would you recommend? Like what other treatments do you think they should do?
They probably should do definitely medical grade skincare, retinol in some form or percentage, and like microneedling and stuff, and just being really consistent with like your tox. Like don't go 6 months. Like every 3 months, make your appointment, keep it, and eventually they're just gonna get better and better.
Yeah, I think so too. Microneedling makes a big difference.
Yeah.
Because that's stimulating collagen to basically regrow and
yes, and it just helps with like the fine lines too. It really, really does. So I think it's just more consistency to help improve those. If somebody has like very faint static lines, a lot of times just Botox, Dysport alone will take care of that. But yeah, if they've had stuff for a while or just then it takes some time. But I tell people just be patient and you'll get there.
Yeah, it might not be the first time, but over time you will notice a big difference.
Yeah. Oh yeah, especially people that pull up pictures. I'm like, whoa,
right?
Like I have one, and I was like, oh my gosh, you have like no lines on your forehead now.
Wow.
But very like pretty prominent ones, a couple years ago.
Yes, which I mean, I really miss Dysport. So, is there? You notice as people get older, they need more units. Generally, is there like a graph?
I have not noticed that. I think I did read something the other day and I was like, that's kind of a cool theory. Some injector posted something about kind of like people that are super consistent with their like neurotoxin, your body almost like stops trying to make that face as much because like it just can't. So it just doesn't do it as much. So there's a theory that like, not that your Dysport or Botox lasts longer, but that you kind of like did some muscle training. Like you're not always making the squinting face because you just haven't been able to do it for a while.
Oh yeah.
And that may affect, the amount needed for treatment. But I haven't noticed, I think, maybe people need more units if they're a little bit older and they haven't done any like other aesthetic treatments. Mm-hmm. But I haven't noticed a big difference in that based on like age and stuff.
I remember because I used to get like between 18 to 29 units on my forehead. And now we started incorporating like my crow's feet and other areas as I get older. But I remember when I was 30, my friend got 55 units and I was shocked.
I think what you're referring to is more muscle recruitment. So like in younger patients, they typically don't treat as many areas that we do as we get older. So like they may just come in and they want their forehead done. And then I do a little bit here just so they don't have like a medial brow heaviness. Well, over time, muscles get smart. So if you've only treated like a little bit in the forehead and just, a little bit in the glabellar region, well, now your crow's feet are going to be more prominent because that's where you're showing expression because you haven't treated it. Or like you may have some recruitment to the bunny lines, the nasalis. So I think that is something that can happen as people get older is the muscle recruitment. And so therefore you're having to treat more areas than you did when you were younger. And honestly, like I feel like, and some injectors, their theory is like, I treat the entire upper face. Like I don't have patients come in and tell me like, I'm just going to put a little bit here and a little bit there. And the reason why they do that is because of the recruitment that you're going to get. Or you may just look weird if we do a little bit here and not treat this area. So I think that's probably what happened is that your friend had been doing it. She got a little bit older and then she ended up needing, this treated because now she's got these really prominent crow's feet.
Yeah, it always surprises me when med spas, like I'll have a friend go in who has barely no wrinkles and they'll be like, oh, here's 50 units. And I'm like, where?
Yeah.
Where?
I know.
But
and I don't know if like some people like they're just adamant about like the recommended dosing or but I think too, you can really freak new people out if you overdo it the first time. Like they're gonna be like, whoa, this feels weird. I don't feel like I look like myself, and then they're pretty like reluctant to do it again. So a lot of times in the new people, depending on like their, what it is they're wanting to treat, their age, I'll go lighter and bring them back at 2 weeks just so that they're not like.
Well, and the price too.
And the price point too.
Can be very shocking.
So just like, if I'm training new people, I'm like, go over pricing with people. Like, and people are like, I'm afraid I don't want to insult them. I'm like, it's not insulting. I don't care how much money you have. People just want to know. I mean, you could have millions of dollars. I don't know too many people that are just like, well, I don't care what I spend,
Right.
I mean, it's better than sticker shock up at the front.
Yeah.
And a lot of times they're not going to say anything because they're embarrassed. Like they get to the front and you're like, oh, that's going to be $1,250. And they're like, in their mind, like, whoa, but then they're just never going to come back to you.
Yeah, exactly.
And then they feel like pretty ripped off. But if you were to go over the reasons that you're doing things and why, and why they need the certain amount, and then they're more apt to do it. And if they're like, you know what, this time let's do this, and the next time I'll do everything, just be upfront about the cost and the maintenance. Like, if it's not something you can maintain, just don't do it. You're gonna spend $600 and you know it's not something that you want to maintain, and so you wasted it, in my opinion.
Yeah, I agree. It's definitely it's
a commitment.
It's a commitment.
Yeah,
sure.
it's like hair extensions. You know, you're gonna spend a lot of money paying for the hair, but you have to go every 6 to 8 weeks, and that costs X amount.
Right.
If it's not something that can work with your schedule, your budget, whatever, just don't get them.
Yeah.
Don't spend the $1,500 on the hair because you're not gonna be able to maintain it. Same thing.
Right, and then you take them out, and then you're back to normal.
Yeah.
Same thing with your. Yeah, that's a really good analogy. So, like, what are complications? Like, what's the worst thing that could happen with Botox?
Lidosis, where it gets into the muscle, like that keeps your lid open, and you have that's probably the worst thing.
Like a droopy eye.
Yeah, like that. You physically can't keep your lid open.
Okay, so that's the worst thing. What do you do if that happens? Just wait it out?
There's a couple things you can do. So you can use actually Upneek, which will help stimulate the opposing muscle to stay open. You can also inject the part of the eyelid that will lift the lid, and then there's other drops that you can use to keep the lid open. But you get a pretty significant improvement with the drops and just injecting a little bit. It doesn't typically last the whole 3 months. It's usually like some leakage of the neurotoxin that gets into that part of the lid. So it doesn't tend to have as much longevity, but it is distressing for people, and it's an obvious, like, it looks bad.
Yeah.
You know?
Yeah, I could see that. So, like, filler migrates. Does Botox migrate? Is that how that happens?
Typically a lidosis, like, there's a weird, like, I think the statistics for at least Botox and Dysport, if it's injected properly, like proper technique, proper dose, the percentage of lidosis is less than 1% a year. Most of the time is injector error, meaning that they injected the neurotoxin like in the tail, like when you frown and make your 11s, there's 5 injection points there. The tail, the last injection point, that almost feels like you're in the forehead, but you're not. If you inject that too deep, then it can leak into the eye.
Oh.
I think with that famous, the influencer that happened to, I think if I remember correctly, is that she went for a brow lift. Like, she had her treatment, went back at 2 weeks. They did a brow lift, but they did the brow lift here. Yes, that is the orbicularis oculi muscle, but what lies right beneath that is the muscle that keeps your eye open. I can always call it the levitator, but it's like levator palpebrae, whatever, some fancy term. And so she hit that portion of not the eye muscle, but the underlying structure, and that's why the girl got a lidosis. You don't do a brow lift at the arch of your eyebrow. I get why one would think that, because you want the arch to come up, but you do it more laterally, and that's why. So her issue was injector error. So yeah, so you know, there is like I said, a small percentage of perfect injection technique, perfect dose, perfect everything that you will get a lidosis, but a lot of times it's just an error that occurred. Too deep, wrong placement kind of thing.
And I feel like Upneek wasn't around at that time.
No.
But now it is.
And there's some other drops that you can use, that similar concept. But I think in watching some of the management of complications, like from other injectors, injecting the opposing muscle and giving the drops really makes a huge, huge difference.
That's good to know.
Yeah.
All right, cool. Well, good. So if you were like brand new to getting Botox, what should you know before your first appointment? What should you expect?
That the duration of treatment, so 2 weeks for it to fully kick in. You may need to go back for a touch-up. That's normal. Some people are like, oh, they just didn't do it right. If there's something that you don't like about it, like whether it's like, oh, I feel like this brow is higher than this one or whatever, always go back to your injector. Those things are super easy fixes. None of this stuff is permanent. It all wears off. You know, talk to your injector about like areas of concern and the look that you want. Like, some people want to be frozen, some people don't. It just depends.
Yeah.
And there's, limits to anatomy too. Like if you have heavy lids or extra skin on your lids or eyelid hooding, sometimes you cannot treat the forehead at all. And so I guess my advice would be to go into that appointment knowing all the facts and then going over anatomy goals and all that with your injector. And just having realistic expectations of it,
Yeah, I think it's good to note that not everyone's a candidate. Like if you have eyelids and your like the way that your eyelids work with your forehead, if you freeze your forehead but you need to raise your forehead to see better, then it you wouldn't like it. Like that's what happens with Steve. And so but he can still get Botox. Shannon's just very strategic in where he puts it
and how much I'm able to do.
Yeah.
And we had a long conversation like before I did his, like, you may feel droopy, you may feel heavy. Like, are you okay with that? And he was, but it was a serious conversation that we had. So just know that, there may be some things that they don't recommend, and there may be other areas that you're like, I don't really have 11s, but if you don't treat that, you're going to look like a caveman. You're just going to have like totally flat brows. And so, if they recommend certain areas, just ask the right questions so you feel like you're, not treating things unnecessarily, but just know that there may be some other things that they recommend that you may not have thought of.
So whenever I get filler or Botox, I always freak out about sleeping afterwards because I'm like, at my pillow, I don't want to lay on it. Am I going to squish it and move it around? Like if I wear a hat, like what will happen?
As far as like neurotoxin goes, like you want at least to sit upright for 3 to 4 hours. You don't want to wear a hat the day of. You don't want to work out after. What are some other things I tell people?
That day.
24 hours, yeah.
Oh.
Just so like, because you want the tox is not fully into the muscle. I mean, it is, but it's not. And so what you don't want to do is displace it, and then you end up having, an undesirable result because you now have moved it to where it shouldn't be. Right. That's just the first 24 hours. If you had your Dysport or Botox done at 10 o'clock, well, by 2 o'clock, you can go to bed if you wanted to and be fine.
What about filler?
Filler,
like when we do my cheeks, I freak out because I'm like, am I gonna just squish it?
I think like I try to tell people not to sleep on their face, like if they can't, like on their sides and stuff. If they can, it really won't change that much. I've not had anyone come back and be like, oh, I accidentally like turned over and now I look weird. So I tell people like, do what you can, but you're not gonna totally mess things up if you were to accidentally like fall asleep on your cheek.
Okay. Well, thank you so much.
You're welcome.
Was amazing. So fun. If you guys enjoyed this, let us know in the comments, and she'll be back on again. We can talk about more things. Leave questions for us. I'm going to leave her contact info if you want to book an appointment with her. I actually have a few followers that come from out of state to see her because she's just that great.
So sweet.
So, yeah, she's amazing, and thank you so much
Thanks,
for being on.
Fun.
This was so fun.